So I am Sheela Roth, and I'm thrilled to have you join us tonight for this exciting webinar. We're joined by a very special guest, Dr. August D. Oliveira, who will be sharing his valuable insights on the role of AI in dental radiology. Especially for experienced dentists and also those of you that are just getting started, we're going to go through and really kind of find out, is it really just the hype or is it valuable in our workflow and for our diagnostics and for our patients? So feel free to type your answers in. Going to get the conversation started. And let's share a little bit about our speaker tonight. So our wonderful speaker, Dr. Oliveira, graduated in the top 10% of his class at the University of Washington in 1997 after completing a general practice residency focusing on everything. Here we go. Endodontics, implants, restorative. He went on to also lecture worldwide on cutting-edge dental technologies, including CAD/CAM, CBCT, dental implants, and you were just sharing a minute ago about 3D printing. The doctor is a pioneer of CBCT guided surgery, an accomplished author, having published many peer-reviewed journals, as well as 3 textbooks. So tonight he's going to take us behind the scenes on his high-tech practice to explore how AI complements clinical expertise, improves diagnostics, and builds patient trust. So without further ado, Doctor, I'll turn it over to you. The floor is yours.
Great. Hello, everyone. Thank you so much for taking time at the end of your day. I'm actually still in scrubs, but it's freezing in my office, so that's why I'm wearing a sweater. So I know you guys worked hard and glad you could spend a little time with me and talk a little bit about AI. So the very long title of this is What AI Means for Experienced Dentists, Myth versus Reality. Which is really long. So really what I wanted to kind of talk to you about, if you guys know me or follow me on Instagram or on Facebook, I'm all about digital dentistry, but more importantly, I'm more about kind of cutting out the BS and what we use in our actual practice. AI has been a buzzword forever. And I refuse to go on LinkedIn anymore because LinkedIn is just all a bunch of sales bros. And we really started talking about AI maybe about 7, 8 years ago, and no one really kind of knew what it was. So what I really want to do is just kind of give you some real world stuff, how I use AI in my practice, and honestly, how much better my life is because of AI and using second opinion. So just a little bit about my background. Graduated ages ago, so 1997. So I've been practicing dentistry for about 28 years. And I've seen a lot of changes. My dad was an electrical engineer, so I was always into tech and got involved with CIREC. If you guys are familiar with CIREC, chairside milling, about 25 years ago. And I thought that was revolutionary. And then cone beam came along. I got a cone beam probably back in 2008 and really got excited about guided implant surgery. I currently teach right now on guided surgery and 3D printing, as well as CAD/CAM milling. So I thought, cone beam, now that is a new thing in dentistry, and that's going to change dentistry. And then I signed up for Pearl in July of last year. And I got to tell you, without embellishing, that has probably had the biggest impact on my practice. I'm totally into 3D printing. 3D printing has made an impact. Having the ability to mill onlays and crowns and veneers chairside with CIREC, that's had a little impact on my practice. Having a cone beam and doing guided surgery. But I would have to say, out of everything, having second opinion and having AI in my office, if you look at the bottom line, has kind of made the biggest difference in my practice. And we're seeing a ton of stuff going on with AI. And it's kind of hard to sort out what is BS and what is real. I just met with a company yesterday about a 24/7 AI chatbot on your website that will take your on call, will figure out the patient's insurance information, give them all the necessary info, help diagnose what their emergency is, and schedule them. And so that's awesome. There's different companies out there, Mango AI, that have actual sort of call center like chatbots that talk like real people. So AI is definitely going to be a part of everybody's practice. And so I'm excited to talk about it today. So just a little bit more. I've been a beta tester and a hardware tester for tons and tons of companies over the last 28 years, most notably 3D printing. And we'll actually talk a little bit about a case I did with a 3D printer called the Midas today. And I am just a nerd in general. I'm really into AR and VR. So if you ever want to talk about anything related to the metaverse, I'm your guy. So when I do lectures, I don't like to just talk at people. And most of the lectures that I do are actually hands-on. Obviously, we can't have hands-on here. So I've got the chat thing open. If you have a question about anything during the lecture, don't wait till the end. Go ahead and post your question, and I'll go ahead and answer it. So what is Second Opinion? So Second Opinion is an AI X-ray reader, which on the surface doesn't sound that exciting. When I first got Second Opinion, it's funny. We have this sort of like, well, AI is not better than me kind of ego play going on. And I post a lot on Facebook and Instagram, and I show a lot of what is real in the mouth versus what Second Opinion diagnoses. And I can't tell you how many sort of low self-esteem dentists chime up and like, well, I could catch that easy. I could see that. And what I always kind of tell my patients is that this is sort of like spell check. Like you don't get mad when you're typing an email and spell check comes up and says, hey, you misspelled though. And so this is just another set of eyes to help you in how you diagnose and treatment plan. One of the biggest things it does is it picks up caries. So just decay that is into dentin, and it can quantify how far decay goes within the tooth. It picks up incipient caries, and we'll talk about caries that are limited to enamel and sort of what you can do about those. There's a really cool feature in the software where you can compare incipient lesions year after year. Bone levels, I got to be honest with you. I don't think this is as cool as it looks. These aren't actual perio probing readings. These are simply, measuring from the CEJ to the crest of the bone and how much bone you've lost. Now, it does open the conversation into the patients. Interesting enough, most of the malpractice lawsuits that are filed against dentists are dentists not telling patients that they've had perio, and they can be treated by perio either by the dentist or by a specialist, and they end up losing teeth. So patients see a bunch of lines on the screen and they say, why is this line white and why is this line red or yellow? And it just opens up and it allows you to tell the patient, hey, look, what this is simply showing is you've lost bone. And the real way that we can tell if you have active periodontal disease is by probing. And so it's just another way to educate your patients. Calculus, this is a big one. I tend to, when I look at x-rays, as a tooth driller tend to not look at radiographic calculus. And this really points it out for you. So again, it's just another way to talk to your patients. I don't know about your patients, but my patients will, go away for 4 years and then suddenly come back. And when they come back in, they're wanting just a prophy. And when we tell them, look, no, you've got active periodontal disease, you need scaling and root planing. They wonder why. Well, you've lost out on 2 cleanings a year times 4, so 8 cleanings. So we can't just do a regular cleaning. So I just tell them, and again, I use funny words in my practice. I'm like, look, you've got a barnacle on your tooth of bacteria, and it is so calcified, you've had it for so long that it shows up on an x-ray. So it's another thing that we can point out to patients. The next is PA lesions. And one of the most surprising things that I have found with Pearl is when we take an FMX, I'm again focusing on teeth. And sometimes I completely ignore PA lesions. And they show right up. The patient can see them really well. And I, again, using layman's terms, is I say, look, you've got a cyst, you've got a pocket of pus on the bottom of your tooth, and you need a root canal. And they'll say things like, well, it's never hurt me. And I'm like, yes, because the pus is draining into your sinus, or your pus is draining into your gums. And that's why. So again, I think there's 2 factors for me with second opinion. One, it's helping me diagnose dentistry. But 2, it's a very visual way of showing patients what's going on in their mouth. And I can't tell you how many times or how many memes I've seen on Instagram where, patients will talk about, you as a dentist or you as a hygienist or a dental assistant can see that decay so well on the x-ray. And then you point to this little kind of gray thing and see how this is a little more gray than this thing. And the patients just, go glassy-eyed on you. So this really helps you educate the patient and tell them, hey, look, you got to floss. You've got all these things going on in between your teeth. Open margins are another thing. And, it's surprising, and we'll talk about actual numbers in my collections that have changed since having second opinion as before. But I can't tell you how many, open margins or recurrent decay I've seen on recall. And I'm just like, yeah, the tooth's doing fine. We'll just keep an eye on it. And this is translated into me doing so many crowns, where before I would just kind of glance over it. The colorization step, and I'll show that later when I pull up second opinion, is probably one of the coolest portions of it. Again, patients are looking at x-rays. We're educated on how to read x-rays, and they just can't see stuff. So especially when I have a patient with an incipient lesion, I can pull up this colorized picture, clearly denoting the difference between enamel and dentin. And patients know enough to know what enamel is and what dentin is. And I can explain to them, I'm like, hey, these lesions are confined to your enamel, but if you don't start flossing, they're going to extend, and we are going to work on them. So again, one more tool that you have. Pre-existing conditions, this is great for my assistants. So when we have a new patient come in, we chart all the existing fillings, all the existing crowns and root canals, and it just spells it out for you. So it really, really makes it easy for you. There is a AI enhanced visualization tool that kind of can allow you to accentuate how decay works. I got to be honest with you, it's kind of worthless. I never ever use it. And finally, this does work on pans. So if you have a panoramic X-ray machine, we have a combined pan and CT, which is a fairly low dose machine. It's the Planmeca Viso G7. So we never really take pans. I personally think pans are kind of useless. So we do a CT scan if we need a CT scan, or we do an FMX. So the Dental AI Society, which I've never heard of, did a really cool study. So we all know that two dentists will never come up with the same diagnosis, right? We're all so very different in what we see or what we treat. And everyone kind of uses the house contractor analogy. I need a new siding on the side of my house. And I got bids ranging from restaining it for $6,000 to ripping it out and doing $50,000 worth of siding. And it's the same thing in dentistry. Some people are, just, fix what needs to be fixed. Some are into occlusal theory, and, every patient is a full mouth patient. But let's take a look at some of these numbers. So 136 FMXs. And the dentists were 50-50, whether there was new decay or not, which I think is pretty huge difference in how we look at x-rays. So half the people said, yeah, you got nothing wrong, you're good to go. Where there was recurrent decay, it was a little bit better. It was 60-40. And then as far as treatment costs goes, these treatment plans ranged anywhere between, a couple $100 to $30,000. So there's lots and lots of variability between how dentists look. And I don't think Pearl or Second Opinion is trying to standardize us. I can totally see where this would be helpful in sort of a large group practice or a multi-office mini DSO. One dentist thinks one way, another dentist thinks another way. It just kind of gives us sort of a standardization. So I bought a Tesla, and have your opinions, what you will, of Elon Musk. I've got to tell you, I think this full self-driving is probably one of the biggest technological advances to happen since the smartphone. So I'm in LA, I'm in traffic all the time, and I don't manually drive anywhere. If I'm going 2 blocks, I put on the AI assisted driving and let it go. And one of the reasons why is, I luckily have not been in a major accident for a long, long time. But I have blind spots on my old car. People drive erratically. They text and drive at the same time. So this full self-driving, which is all AI based, is really, really cool. And if you think about it, when you're driving, right? Let's say you're full on, you are in it to win it, you are watching the road. You've only got 2 eyes. And so the AI has 6 eyes. Basically, it can watch from the back of your car, from 2 sides of your car, and in the front. So it's not distracted. So I don't know if you guys remember the hoverboard dentist who got 14 years in prison for extracting teeth on a hoverboard. And I don't think we're as distracted as this guy was. But think about this. I'll be, really into a root canal, and my brain is just thinking about where that second canal is. And of course, always at the wrong moment, your hygienist comes up to you and says, hey, recall patients waiting. And then I run in and I look at the x-rays. And while I'm looking at the x-rays, I'm most likely thinking about the root canal that I'm working on. So we are always somewhat distracted. Now, if my schedule is slow, I sit down, in my office with my big 40-inch screen, and I can look at these sort of lesions and kind of take my time. But it's the same thing. The AI of second opinion is never rushed. It's never, distracted. And I can't tell you how many lesions that I have missed. And I'm not afraid to admit it. I think that when we look at x-rays, we concentrate on the center of the x-ray, right? And it's what's in the periphery that usually gets missed. And interesting enough, when you sign up with Second Opinion, they go back a year and they analyze your patients for a year. And every time the patient would come in for the recall, even if it wasn't their 6-month checkup, I would have to have this uncomfortable conversation with the patient saying, hey, we missed a tooth. And so, having AI and sort of framing it as, well, the AI is better than us, has been a really great sort of aspect, and sort of convinced patients to accept treatment where I had missed it before. And I've had posted some stuff on Facebook, and a lot of people just sort of ask me, well, like, what do you do with a doubting patient? So a patient's like, hey, I've never had a cavity. Now all of a sudden I've got 4 cavities. It sounds like it's a money motivated thing and it's not real. Wait, tell them, okay, well, we've missed this for a while. Let's go ahead and wait until your next set of x-rays. And then we can compare the two. And if that decay is truly there, it's going to not only show up in the x-ray, but it's going to get bigger. And the fact that it's getting bigger is on you and not me. So again, it's an interesting vibe that you have in the office. Now you're basically saying that the AI is better than you. So this graph was pretty humbling. So I thought to myself, okay, started in July of last year, and now we've come full circle to the end of July, or we're almost at the end of the July now. Now, how much more dentistry did I really do? So I went back, I went into Eaglesoft, and I pulled up my actual numbers, and they're actually kind of embarrassing. So I'm going to share my numbers with you. And look, I am a 1 doctor office. I teach a lot. And I actually had a really good few months before July. So this was not my yearly production for the year. But before Pearl, I did about $800,000 with my average month being somewhere around 60,000 a month. Now let's go to 1 year. And so at 1 year, I'm up almost 34%. And I've actually gotten so busy lately that I've added a dental assistant. And so this is real. With CIREC, I cut down my lab bill, right? When I started doing implants, I've added implants to my practice, and that kind of boosts things maybe about 10 or 15%. But I've never had anything in dentistry actually increase my collections by this amount. So it's certainly really exciting. So let's go on an actual case. And everybody, I know you guys are tired, but let's focus on the upper teeth. So I'm going to look at these teeth, and with no AI, I'm going to say, okay, tooth number 2, underneath that distal cusp, I see some decay. On tooth number 3, maybe I got an incipient lesion. Tooth number 4, looks like there's something going on the mesial, and tooth number 5, right? And so if I turn on the AI, you can see how it's really outlined all these things. So it really, really kind of just makes them pop. I'm old school. So what I do is I actually have a notepad in my office. So I'll sit down and kind of write all these things down. But now check this out. So let's look at the mesial of 3, and let's look at the mesial of 4. So both of those, yeah, are in fact incipient lesions. But if you look a little closer at the DEJ, I see a shadow definitely on 3, and I see a little bit of a shadow on 4. So to prove to myself if this was true, I started taking pictures mid-decay and I started posting them on Facebook. So if we go to the next, this is the extent of the decay. So Second Opinion picked up an incipient lesion on 4 mesial. I looked in the mouth and I found that there was something cooking on the distal of 4 as well. But take a look at how far these incipient lesions extended into the dentin. So quite a bit. And a lot of people on Facebook don't read posts. These are not my final preps. I just remove the decay so that you could kind of see into the tooth and see what it looks like. And so we went ahead and we restored these teeth with just basic composite. And I always get asked, lately I've been obsessed by these cheap eBay rings. So anyone out there use Garrison? I freaking love Garrison, anything made by Garrison. And I had a bunch of kits, and I had an assistant who actually Chat GPT helped me fire her. That was terrible. And she kept throwing away rings. And a lot of the times I don't pay attention to how much these Garrison rings cost. They're about $200 a ring. So if you're not opposed, I know it's kind of shady, to going on eBay, there's a company that's basically made duplicates of everything Garrison makes. And it's called All Seasons Dental. So I love their Garrison clone wedges. They have their own rings that I actually like more than the Garrison rings. So check them out, All Seasons Dental on eBay. So here's another patient that came in. And looking at the x-rays, things don't look so bad, right? So we can pick up, there's definitely some decay on tooth number 5 distal. And in my initial treatment plan, that's all I kind of saw. I saw maybe there's something going on 4 mesial, but I didn't really think that there was anything more going on. When we turn on the AI, you can see, God, there's a lot of decay going on. So for 4 distal, incipient lesion on 4, looking in the mouth and actually prepping. Actually, let me just go ahead and let me talk about this. So I teach 3D printing. I don't know if anyone have heard of the Sprint Ray Midas. Sprint Ray Midas has a system that actually can print with a 60% filled ceramic. So this is meant for ceramic inlays and onlays. And I really wanted to do this on this patient. I love it for implant crowns because with implant crowns, we don't have a PDL. So having the flex of this material makes it really ideal for screw retained crowns. You've got these little cartridges. They're coated. It kind of freaks me out because it reminds me of the Squid Game. But if you don't have a CEREC machine, you can buy a Midas for about 35 grand for an intraoral scanner. It has an AI-based restorative system. You don't need to learn exocad. So it's a lower cost way of getting into it. So here's the decay that when we got into it. And so there was a fairly large composite on 2, and I removed that. The decay was fairly deep on tooth number 2. We found decay on number 3, mesial. Tooth number 4 on the mesial and the distal, and on 5. So I really wanted to try out this Midas thing. So we ended up designing this in exocad. Tooth number 5 actually turned out to be an onlay, and tooth number 2 ended up being an onlay. And so we did 4 restorations. She needed a crown on number 13, and she had cracked tooth syndrome. So what I wanted to do was print her a crown. I wouldn't normally use composite for a crown, but I wanted to print it, bond it, and see if it took care of her CTS, and it did. And so here's the final restoration. Sorry, there's a little extra flash on tooth number 3. So we did a DOL onlay on 2, an MOL on 3. We did an MODB on 4, and number 5 onlay. It took us about 2 hours to do it. And so that's all I have for you. And it actually looks like I'm ready for the Q&A. So Sheela, are you still there?
I'm here. Yes, that was quick.
That's quick.
Excellent. Well, thank you so much for sharing all that information. Great cases. And I'm curious to see, before I open this up real quick, um, what did your patients initially think when you were showing them AI images and teeth in color? Was it surprising? Was it exciting?
Yeah,
Um,
yeah. And actually, you know what? Let me go ahead and do this. Let me just pull up second opinion and kind of show you. So I pull this up here. I thought I had another window here, but I guess I didn't. Let's try it again. Yeah, it's been one of the coolest things for patient education. And so again, you know, you're younger than me, but when I started in dentistry, we literally had film X-rays that were about an inch long, and I don't even know how I looked at those. And then we graduated to having 15-inch monitors in the screen, and now we have 20-inch monitors. And in some of my operatories, I have 55-inch monitors. But yeah, it's little black dots on a black and white image. So what's really great is, this is the patient that we did the composites on, is I can zoom in. I'm sorry, my mouse is acting a little freaky. And what I like to do is I'm like, okay, guys, let's do this. Let's go ahead. And sorry, the camera's in the way. Is I turn off the AI and I say, hey, can you see this here? And can you see this here? And sometimes they say yes, and sometimes they say no. But I just want to prove to them that it's not just AI saying there's decay. There's actually something underneath. And then when we turn on tooth parts, that really makes it happen. And I got to be honest with you, I think it does give me a better conversation with the patient. I'm not a chatty Kathy or chatty Charlie. And so, but I do like to talk about tech. And I think a lot of people are using Chat GPT and they're using AI in their work. So I didn't have a lot of pushback with the AI. I said, AI and radiography started with breast cancer exams, and they've moved over to where we're doing it. So on something like this, if I wasn't going to treat it, then I would say, hey, do you see this white stuff here? That's your enamel. That's the white part of your tooth. It's like hair and fingernails. It has no nerve endings, but the green part is the dentin, and it's soft, and the decay can spread. So yeah, it makes it really easy for it to see. So we do have a question here. Pediatric dentist, are there any special features for pediatric patients? I don't think so, right? Do you have anything special for pedo?
we do. It is coming out very soon. I'm glad that's like a planted question there, right? Um, we do have a really great feature. I'm going to see if I can get that image up before the end of this webinar, but where you can actually pick a little cavity bug, which type you like, and it'll kind of peek out behind the lesion there. So it'll have little eyeballs, and it's really, it could be alarming, but I think it's great for education
Disturbing.
purposes. So I think that would be really a huge advantage for pedo, especially because we're talking to kids with pedo, but we're also talking to the parents, and hopefully they've been talking about cavity bugs since they've been born, right? But I do think that making it a little more fun, and I am no specialist in pediatrics, but I do have kids, and I remember you've got about 30-second attention span, and they're adults now, and it's similar. So I think that would be a huge advantage. Obviously, the tooth parts are great. And when you're talking to parents, they really kind of need to be able to ask the question, well, aren't those teeth just going to fall out? Right. And that's a lot of the questions I used to get as a hygienist was, well, why would we need to fill those? Right. And you have to explain the entire process about why you have baby teeth. So great question. I think that's important. I like how you talked about how you use it chairside. We get a lot of questions about accuracy. So a lot of times in the very beginning of Pearl, a doctor would purchase Pearl and they would say, well, I beat the AI, so I don't need it anymore. I just wanted to see if I beat it. And I did say, well, what did your patients say? Right. And they hadn't used it with the patient. Then they ended up keeping the tool. But I'm curious for the doctors that are on the call and they're wondering the same thing. What would you tell them as far as, the reality of AI not being 100% accurate and you're going to see false positives or false negatives? What is your opinion there?
Yeah, it actually makes me look a little bit like a hero, right? So I'll say, look, I grew up with the Terminator movies. I don't completely trust AI. And I also say, it's just like spell check, right?
Mhm.
Sometimes it corrects what I'm writing and it corrects it wrong. So I say, I still have a job. And you know what I bought, which is really kind of funny? So I got really into transillumination. So there's lots of these, high intensity lights that you can shine through the teeth. Um, and I bought one, I think it was like $500, and it sucked. It just did not work really well. So someone told me about something called a bore light, and let me just type that in, bore light. If you go on Amazon and type in bore light, a bore light is used for cleaning a gun. And it's a really high intensity light, and it actually has a curved tip,
Hmm.
just like our old curing lights that we had back in the day. So we just put a sleeve on it, and they're about $8 on Amazon. So I have these in every room. So what I do is I say, hey, I don't completely trust it. So I'm going to go old school. I'm going to take this really sharp Explorer and jab your tooth with it. And if it sticks, then it's decay.
Hmm.
Sometimes it's not decayed enough to get a stick. And so I shine the bore light. I turn off the overhead light. I have the patient look with a little mirror. For some reason, with flash photography, transillumination just doesn't work. But I also do that. And, we talk about accuracy with AI. So what I have found personally, and I'm just going to be honest with you, there are a bit of false positives in the anterior, right? So if someone has number 7 or 10 with like a real pronounced lingual pit, it'll show up those lesions. If someone has really deep, class 5 fractions, those will show up. So it's not perfect, but I call it my dumb radiology assistant. Uh, because basically it's like someone going, hey doc, did you see that? Hey doc, did you see that? Did you see that? And sometimes they're wrong, which is
Right.
fine. You don't have to agree with everything that it says. And one of the cool things about it is, okay, you just tell the patient, like, I don't know, it's saying you have a cavity. I don't think it has a cavity. So let's wait a year, right? Let's
Mhm.
just wait a year and see. And if it's gotten bigger, then we're going to work on it. So again, you're the hero. And so I think some kind of dumb dentists are like, I'm better than it, right? And it's like, well, okay, slow down, cowboy. No one's damaging your ego. No one's coming for your job. But if you can make your life easier, and again, it's like my Tesla on full self-driving, right? Sometimes, it like waits too long on a stop sign. And I'm like, oh yeah, I could totally drive better than that. But I have a chauffeured car, right? So basically I have, for I don't know what it is, $350 a month, an associate looking at all my x-rays. So yeah, it's great. You don't have to believe it all.
Excellent. Well, I do think that's a great answer. Also, I think a lot of times people wonder how long does it take to load an x-ray, right? And so I'll answer that myself, but mainly you're going to get that in real time. So you
Mhm.
take a bite wing, by the time you're ready to place the next bite wing, the analysis is already done. This overlay here is the tooth parts. It's sharing your screen, right? I think I switched back to you.
Yeah, yeah.
Um, so that's just one click of a button. And a lot of times workflow is really kind of the biggest barrier to adopting new technology, but we're already taking x-rays.
Mhm.
already viewing x-rays and we're already sharing x-rays. So now it's just a matter of clicking into another view. I like what you said about having it be spell check, right? Because we all know how to spell, but every once in a while we move over and we think, oh, there's an EI there. And I feel like that's pretty common for what you said earlier about periapical radiolucencies. 49% of those go undetected, which is a shocking number
It's a lot.
to think about, right? So I think in closing, um, if there are any other questions, please feel free to ask them. We will answer them. But I'd like to know just kind of if there's anything that you would say, doctor, for those teams that are kind of on the fence. Um, should they go with AI? Is it expensive? Is there a learning curve? Is there anything you would do differently when you implemented it?
Yeah. And actually, if I could add one thing, one question I get asked a lot on Facebook is, does it integrate with, EagleSoft and Dentrix and all that stuff? It does, but it sucks. So what we do is we just have our browser. We have a little tab on the browser. We open up the browser, and the interface of Second Opinion is way better than anything I've ever experienced in Dentrix or in EagleSoft. So it's a better X-ray browser. But to answer your question, if you're on the fence, I mean, it's a lot of dentists, they do this too with 3D printing. They're like, I don't know, that printer is $500 because we're different types of printers. Yeah, it's $500, right? It's like 2 fillings. So, I mean, the thing about Pearl is it's not like buying a cone beam or buying a CEREC machine. There's really no risk. I think it's like $500 to have them install it and to go back over your old X-rays, and it's $350 a month. So I made an extra $200,000 last year. Collections. This is not production. This is collections, right? And I spent $3,500 or $4,000 on Pearl. And so the ROI is great, but if you don't like it, then you're out $500, right? The $500 setup fee. So it's not going to, make you not retire and you'll have to work for 5 more years. It's like it's $500, guys. So it's not a big deal. But I will say, and this does sound like a planted statement, that nothing has boosted my production more than Pearl in my 28 years of dentistry.
That's a
Yeah.
real great statement. That's the first I've heard from you saying that. So that's great. I think it's to me very obvious working with so many teams and they see all of these different pathologies and I like how you said too, you're the hero half the time. So
Yeah.
if we're not filling it today, we're planting the seed and we're really kind of being able to revisit that next time. We would invite you for a demo as well at Pearl. We'd love to have you click on this QR code and see if it's a good match for your team. In addition to our second opinion, we also have practice intelligence where we'll look into your existing practice management system. And if we don't see a code that would resolve a cavity, we're going to highlight that as an AI finding for you. So you'll have daily surfaced AI actionable items that aren't treatment planned. And we will verify all your patients as well over the next 10 days. So if you think it's a good match, what I love also about Pearl is it's month to month. So to your point, there's many things when I ran a dental practice, we purchased all the time and you're stuck for a year. And we didn't like that. But I think for that fee and really for me, again, back to hygiene, the patient education side is really worth it in itself because we spend so much time explaining black and white and this triangle shouldn't be here. It's supposed to be just white or with the hygienist, the bone level is supposed to be here and you're holding pencils up compared to the image. You kind of look like a crazy person, really. So I really enjoyed using Pearl before I transitioned over to working here full time. But that bought us a lot of time to stop talking and listen to what our patients were asking about. And I think that really is what led to more case acceptance. So, um, again, thank you so much, Doctor, for joining us tonight and spending your time sharing about your cases. And I really appreciate the real organic feedback about all of the different features inside of Pearl and also other AI companies. It's nice to have somebody that will tell you the truth. We look forward to having you on more webinars, and this
Got it.
will also be on demand. So feel free to jump on hellopearl.com, and at the bottom, you'll see a section for all of our on-demand webinars. And those of you that joined today will also have this recording sent to your email. And again, thank you so much for taking the time to be here tonight, Doctor, and all of you that joined us this evening. Have a wonderful night, and we look forward to seeing you soon.
Thank you.
Bye, everyone.
Bye.